We're going to discuss chapter 5, which is regarding the eye. The first slide here is showing you just the anatomy of the eye, so that when you learn some of the words, you can go back and look at this picture, which is the eye is considered an organ that provides a three-dimensional vision. It has two chambers. It has what we consider the anterior chamber that contains water fluid called aqueous humor, and a posterior chamber that contains a gelatinous fluid called vitreous humor or vitreous humor. Each eye is located behind or within a bony orbit of the skull, and that's to help protect the eye. So a lot of times people that get hit in the eye, the object's big enough, it'll break the orbital bone versus penetrate the eye. The eye is also protected by the eyelid. The job of that eyelid is to help protect anything from penetrating in there. When we look at certain parts of the eye, the tunic layer refracts light that enters the eye. And when we look at the sclera, it's a white, tough, fibrous outer eye layer that extends from the cornea to the optic nerve. The cornea is the transparent outer covering of the anterior portion of the eye. And then light enters the eye through an opening called the pupil, which is that usually black in color, and it dilates. The muscles of the iris regulate that pupil size. The conjunctiva is the mucous membrane that lies lining the eyelid and the outer eye surface. And then the lens is a transparent structure posterior to the pupil that bends light rays on the retina to aid in focusing. The retina is the nerve tissue in the interior part of the eye. When we look at the lacrimal apparatus, or the lacrimal, it refers to the lacrimal ducts and the glands. You can see this picture here showing, so this would be your tear glands or tear ducts. So it secretes tears. When we look at some of the words, so aqueous, we said aqueous humor was that water liquid secreted by the ciliary processes that fills the anterior and posterior chambers of the eye and provides nourishment for the cornea, iris, and lens. So aquea meaning water, and then humor means fluid, so watery fluid. Blepharo, so means eyelid, blepharo, so blepharospasm would be a spasm of the eyelid, your eyelid twitching. Conjunctiva, that's going to be the mucous membrane that lines the eyelids and the outer eye surface. It means to conjunctiva, to join together, brings that together. So conjunctival, AL meaning pertaining to, so pertaining to the conjunctiva. Some people say conjunctiva, so it just depends on how you want to pronounce that. Conjunctiva is basically how it would be pronunciated within the book. Corneal is pertaining to the cornea of the eye. Kerato also means cornea, so keratoplasty, plasty meaning surgical repair of the cornea. Iris is the iris, the part of the eye. Iris is the colored part, so whether it's blue, green, brown. Itis, inflammation of the iris, or the colored circle. Iridectomy, so remember ectomy would be like an excision or removal. Cyclo is the ciliary body. Circles, so cycloplegia, plegia meaning lack of feeling. And lacrimal, dacro are both pertaining to tears, so lacrimal. Dacrocyst, so a cyst within the tear ducts. Oculo, optimal, and opto, all referring to the eye. So ocular is pertaining to the eye. Ophthalmology is the study of the eye, versus optometry, which is the measurement of the eye, would be the vision. So when you usually have an eye disease or problem, you go to an ophthalmologist, the person that studies the eye. When you go to an optometrist, you go to a person that studies the vision of the eye, so where you would get your eyeglasses. Phaco, which could be with a C or a K, is referring to the lens. So when we look at lysis, that means to loosen or destroy. So you might have a phagolysis, would be a detachment maybe of that lens, which could be on purpose. Phagoma would be a tumor in the lens. Photo refers to light, so photophobia, fear of light. We see that a lot with some conditions like meningitis. It hurts, painful, so they fear the light. Presbyo, presby is old age, and remember when we look at OPE, and then IA is condition of, so that would basically mean the aging of the eye. So, and usually loss of vision with aging, presbyopia. Retino, referring to the retina, retinopathy. So here we're talking about the disease of a retina, opathy, meaning that disease. Sclera, the heart, sclera means hardening, so scleritis, inflammation of the sclera, remember, would be the white part, the white tough fibrous part. Vitreo is glassy, vitreous, pertaining to the glassy part or the watery part. Another suffix is opia, it's condition of vision. So hyperopia, we have a the suffix in there meaning that this would pertain to vision, and it would be considered farsighted, which we'll look at some of those conditions. We have anatomic terms. The anterior chamber is the fluid-filled space between the cornea and the iris. The aqueous humor is that watery liquid secreted by the ciliary processes that fills the both the chambers of the eye and provides nourishment for that cornea, iris, and lens. The canal of Schlemm is the duct in the anterior chamber, and it carries aqueous humor to the veins and bloodstream. And when we look at the word choroid, it's a vascular layer beneath the sclera that provides nourishment to the outer portion of the retina. The ciliary body is the ring of tissue behind the peripheral iris that's composed of ciliary muscle and the ciliary process. Conjunctiva or conjunctiva is that mucous membrane that lines the eyelid and the outer surface. Cornea is the transparent anterior part of the eyeball covering the iris pupil, and anterior chamber that functions to refract or bend light to focus on a visual image. So we need that for eyesight. The eyelid is a movable protective fold that opens and closes, covering the eye, also called palpebra. And then fovea centralis is the pinpoint depression in the center of the macula lutea that is the site of the sharpest vision. Fovea means pit. When we look at the C's gland or glands of C's, it's oil glands opening to the follicles of the eyelashes. And then we have meipomian glands. Meipomian is oil glands located along the rim of the eyelids, also called the tarsal glands. The iris is the colored circle of the eye behind the cornea that contracts and dilates to regulate light passing through the pupil. Lacrimal glands and ducts are the gland in the upper outer region above the eyeball that secretes tears, and the ducts are tubes that carry tears to the lacrimal sac. The lens is a transparent structure behind the pupil that bends and focuses light rays on the retina. A macula is the central region of the retina. It's responsible for central vision. Optic disc is the exit site of the retinal nerve fibers, as well as entrance point for the retinal arteries and exit point for retinal arteries. So the optic disc, and then the optic nerve is the nerve responsible for carrying impulses for the sense of sight from the retina to the brain. So to kind of transmit what you're seeing. Posterior chamber is the space between the back of the iris and the front of the vitreous chamber, filled with aqueous humor. The pupil is that black circular opening in the center of the iris through which light passes as it enters the eye, and it dilates and constricts. The retina is the innermost layer that perceives and transmits lights to the optic nerve, and it has cones and rods within that retina. The sclera is that white, tough, fibrous outer coat extending from the cornea to the optic nerve. Trabecular meshwork is mesh-like structure in the anterior chamber that filters the aqueous humor as it flows into the venous sinus. And then vitreous is a jelly-like mass filling the inner chamber between the lens and retina that gives bulk to the eye. When we look at some of the symptomatic terms, asthenopia would be eye strain, so asthenia meaning weak, so somebody's straining to see. And then we have blepharospasm, that is involuntary contraction of the muscles surrounding the eye, causing uncontrolled like blinking and squeezing that lid. Diplopia is double vision. Exophthalmos means that the abnormal protrusion of one or both eyeballs, so that it's the eyes look like they're coming out. Lacrimation is secretion of the tears. Nystagmus is involuntary, rapid, oscillating movement of the eyes. They kind of go back and forth. And photophobia is fear, sensitivity to light, and scomota. Scomota would be the blind spot of vision, so a darkness area of darkness. Some diagnostic terms, when we say refractive errors, defects in the bending of light as it enters the eye, causing an improper focus on the retina. Astigmatism would be a distorted vision caused by an oblong or cylindrical curvature of the lens or cornea that prevents light rays from coming to a single focus on the retina. Hyperopia, farsightedness, versus myopia is nearsightedness, and presbyopia is impaired vision by old age or loss of accommodation. And accommodation is the ability of the eye to adjust focus. So like we would say, look at something near and far, you know, look at my pen and then look at the wall. So can you accommodate near and far without the eyes having issues? Amblyopia is decreased vision in early life because of functional defect that can occur as a result of a strabismus, refractory errors, or trauma, usually in one eye, often referred to as a lazy eye. Aphakia is absence of the lens, usually after like a cataract removal. Blepharitis is inflammation of the eyelid. And then we have blepharochalasis. It's a baggy eyelid or a weak eyelid. Blepharoptosis, drooping of the superior eyelid. The suffix ptosis, with the P is silent, means drooping. Chalazion, chalazions, spelled a little bit different, that CH is a K. It's a chronic nodular inflammation of a tarsal gland, usually from a blocked duct, and then you have swelling on the upper or lower eyelid. Chalaza is a hailstone. Cataract is where we have an opaque clouding of the lens, causing decreased vision. Conjunctivitis would be inflammation of that conjunctiva, often caused from a bacteria referred to as pink eye. Dacrodenitis, inflammation of the lacrimal gland, and dacrocystitis is inflammation of the lacrimal sac. Diabetic retinopathy is a disease related to diabetes, where people have capillary leakage, bleeding, and new vessel formation, leading to scarring and loss of vision related to lack of perfusion from diabetes. Tropion is the outward turning of the rim of the eyelid. Tropo means turning, versus entropion is the inward turning of the rim of the eyelid. And then epiphoria or epiphora is abnormal overflow of tears by blockage of that lacrimal duct. And then glaucoma would be a group of diseases that has increased interocular pressure that will eventually result in damage of the optic nerve, resulting in decreased vision. A hordeolum is an acute infection of the sebaceous gland of the eyelid, also referred to as a stye. Irisitis is inflammation of the iris, versus keratitis is inflammation of the cornea. Macular degeneration is a breakdown or thinning of the tissues in the macula lutea, and it results in partial or complete vision, often seen with age. Pseudophakia is an eye in which the natural lens is replaced with an artificial lens. Pseudo meaning false. Pterygium is a fibrous wing-shaped growth of conjunctival tissue that extends to the cornea, developing most commonly from prolonged exposure to UV light. And then retinal detachment is the separation of the retina from the skin portion. It disrupts vision and results in blindness if not repaired. Inflammation of the retina, retinitis, strabismus. It's a misalignment caused by intraocular muscle imbalance, so results in like a crossed eye. And heterotropia is a condition of eye misalignment caused by muscle imbalance. This also is referred to as strabismus or crossed eye, so it's words that are used the same. Scleritis is inflammation of the white fibrous sclera part, and trichitis is misdirected eyelashes that rub on the conjunctiva or the cornea, resulting in irritation and or pain. This picture here kind of gives you an idea of how the sight is going through the cornea when you have the far-sightedness and nearsightedness, so hyperopia and then myopia. When that person's myopia, the close things are blurry, and the myopia, distance are blurry. Cataract, you can see here it kind of shows how it would result in the hazy or gray looking matter that's over the eye, and then it's clouded. So when somebody looks out, it's a hazy vision, and it's kind of what we call oblique, kind of through the center of the eye where somebody sees. This is strabismus, the esotropia. So you can see the eye going inward, where the exotropia, the eye is going outward. Chalazion, this would be the one that you could see that the chronic nodular inflammation results in a blocked duct, has a swelling. You can see this one's on the lower eyelid, often called a hailstone. This just kind of shows you vision, like if you were to normally read, and then if you had cataract, you can see through the middle, it's hazy. And then a diabetic retinopathy, they end up having black spots through there, or blind spots when they're looking. Glaucoma, it's the peripheral vision, so the outer side. And then glaucoma would be, or macular degeneration would be the loss of central and the middle vision there. Lower lid ectropion, so you can see here that lid has severe bilateral lower lid. You can see it turning there outward, where the entropion is causing the lashes to rub on the cornea over here. So this one, the eyelid's going downward and can drain a lot, where this one you can see the lashes are flipped upward and rub against the cornea, so they're going inward. There's the upper lid, hortulum, which remember is a sty, so it could be painful. And then there's that pterygium, often caused by overexposure of ultraviolet lights and drying. So you can see it kind of has a haze going across there. Some diagnostic tests that we use to check for people's their eyesight. Distant visual acuity is the ability to see details and the shape of objects from a specific distance, usually about 20 feet. A Snellen chart is often used, and then they're looking at the visual acuity, which is what we refer to as 20/20 would be normal. Fluorescein angiography would be the visualization and photography of the retinal and intraocular vessels using fluorescent dye. It's injected into a vein and circulates through the eye. Ophthalmoscopy, this would be the use of an ophthalmoscope to look at the interior of the eye. Sonography is using ultrasonic or high-frequency sound waves to detect the pathology within the eye, so maybe a foreign object or a detached retina. Tonometry is measuring the intraocular pressure, which is elevated when we look for a glaucoma. And then the Snellen chart would be that, again, looking at letters, like I might start with a big E on top, and then the letters get smaller and smaller on each line, kind of like you do when you, there's a Snellen chart here, when you go to the DMV. When you have an eye exam, this is a doctor here using a ophthalmoscopy or an ophthalmoscope. It's looking into your eye to be able to see on the slide here, the B, C, and D. You would be able to look at the normal retina would be B, and then C, and there's an aneurysm seen. So we see with diabetic neuropathy, you can see the vessels there being bulged, and then a retinal detachment. The retina is up floating above the right upper side on that D. Tonometer, this is where they're going to, again, look in the eye, but they can also measure for intraocular pressure. You'll often feel that air going into your eye. Some operative terms: blepharoplasty is a surgical repair of the eyelid. Cataract extraction is just that. You're going to excise that cloudy lens from the eye. Cryopexy is the use of intense cold to seal a hole or tear in the retina. Cryo meaning cold, and then repair. Dacrocystectomy is excision of a lacrimal sac. Enucleation would be excision of an eyeball, often replaced with a fake eyeball, so this would be a plasty or prosthetic eye. Iridectomy is going to be excision of the portion of the iris tissue. Keratoplasty is corneal transplant, so you're going to replace a diseased or scarred cornea with a healthy one from a matched donor. And laser surgery is use of a laser to make incisions or destroy tissue. And then LASIK surgery is laser assisted in situ keratomyolysis. So that means in situ means localized. And then when we look at smileusis is carving. So they're using a light to, or a laser light to kind of carve into and repair vision. Intraocular lens implant, IOL, is implantation of an artificial lens to replace a defective lens. And then phacoemulsification is use of ultrasound to shatter and break up a cataract. And then they'll aspirate and remove that. Scleral buckling is surgery to treat retinal detachment, and they'll put a band of silicone around the sclera to cinch it toward the middle of the eye and relieve the pull on the retina. It's often seen or done with the retinal tears. Here's the laser, picture of a laser application. Some therapeutic terms: contact lens is a small plastic curved disc with optical correction that fits over the cornea. So it's usually used in replacement of eyeglasses. Eye installation is a medication solution in the eye, usually by a drop, or it could be ointment as well. And irrigation is washing of the eyelid with water or fluid, often normal saline. Some medications we see: antibiotic or ophthalmic solutions, antimicrobial agents in solution used to treat bacterial infections like conjunctivitis, like pink eye. Cycloplegic is agents that paralyze the muscle and the powers of accommodation. So when you're doing an exam on children, sometimes you have to use that to get them to stay still. Mydriatic is an agent that causes dilation of the pupil. So we need to instill that for certain eye exams. And a miotic is an agent that causes the pupil to contract. And that's it for chapter 5.